Assalamu alaikum. I hope you're all doing fine. I'm Dr. Muhammad Ali Rabbani, and today we are going to discuss the gross anatomy of diencephalon. In this lecture, by the end, you should be able to enumerate the structures that are present in diencephalon, infer different views, the sagittal, coronal, transverse views of diencephalon, look at various components in each of these sections, and describe the relations of structures that are present. This will be followed by lectures on thalamus, independent lecture, and hypothalamus. And feel free to subscribe to our channel and explore our channel for these and many more other lectures. So, when talking about the embryology, the brain itself was made up of three major parts: the forebrain, the one shown in here and here, the midbrain, and the hindbrain. The forebrain was further divided into two parts. The bigger one shown right here, that is telencephalon, and that is making up most of the cerebral hemispheres, and the one that is inside, that is the diencephalon. So diencephalon is the part of the forebrain that is majorly present inside the cerebral hemisphere. Outside, on the superolateral and inferior aspect, it is covered by telencephalon. Diencephalon, if I'm this picture is an inspiration from Dr. Najib's lecture. Let us build up diencephalon step by step. So this is the brainstem. Here will be the spinal cord, the medulla oblongata, pons, midbrain with its two colliculi, pair of colliculi. Let's start with the most prominent structure of the diencephalon, the thalamus. On If the brainstem is here, on either side, just superlateral to them, there will be two thalami. We will be following the internal structure of thalamus in another lecture. And in thalamus, apart from the different nuclei that are present, two prominent ones that are present on the outer aspects are medial and lateral geniculate bodies, respectively. So these are two thalami. Below and lateral to the thalamus, just below and lateral to the thalamus, is subthalamus. So it is above the midbrain, it is below the thalamus. So there is subthalamus. Anatomically, we will see the location right here, and functionally, you will study this when talking about basal ganglia. It is a part of that circuit. Then look at the third ventricle. Between the two thalami is the third ventricle. This is a CSF containing cavity, and it extends well beyond the thalamus. We will see shortly that it is extending into the hypothalamus. So this is the cavity of the diencephalon. Just where the anterior end of thalamus is, here the third ventricle communicates laterally with the lateral ventricles, and the openings, the connection between the third and the lateral ventricles, are called foramen of Monro. So you will see both of them on either side in front of anterior end of each thalamus. On the back, you will see a projection, that is the pineal gland. Pineal gland is connected to the diencephalon through its stalk. There is the pineal stalk, and on the base of the stalk or behind each thalamus there is habenular nuclei. These are habenular nuclei, and these are connected through the upper aspect of the stalk, and through the midline crossing fibers. These are called habenular commissures. Next is in the green that is shown, that is hypothalamus. This is present anterior and inferior to the thalamus. This could have been drawn a little better if this extension on this aspect could also have been shown. So it is present anterior and inferior to the thalamus, and it is present on either side of the third ventricle. We will see hypothalamus in detail in another lecture, but one of the most prominent features we are going to see here. On the under aspect, there is a raised area. This one, this is tuber cinereum, and tuber cinereum, here is tuber cinereum, and from that there is stalk infundibulum, and that continues as the posterior pituitary, and then there is anterior pituitary present here, also known as hypophysis cerebri. On the under aspect, there is a bilateral downward projecting structures. These are the mammillary bodies. So these are the structures that are present. So up till now we have done thalamus, hypothalamus, pineal gland having a nuclei and commissures, third ventricle, hypothalamus including tuber cinereum, infundibulum, pituitary and mammillary bodies. To complete the pictures, we will add the visual pathway. There are two retina of the eye, optic nerves, optic chiasm, optic tract on either side, and they are ultimately terminating onto the lateral geniculate bodies. So these are the part of diencephalon. So all these structures, these are part of diencephalon. To summarize, third ventricle, main thalamus also known as dorsal thalamus, hypothalamus, subthalamus, epithalamus consisting of pineal gland, habenular nuclei and commissure, and optic nerve, retina, chiasm, tract. So all of these structures are part of the encephalon. So let's try to figure out how these structures will be seen when you are seeing the gross anatomy of the encephalon. Let's suppose you are trying to see brainstem from behind. What you will be able to see? So you must be able to see the posterior ends of the thalamus. You should be able to see the pineal gland, and below it you should be able to see pair of superior and inferior colliculi. So let's see. This is a pictures of Netter's atlas. So this is the spinal cord. This is the medulla oblongata till this point. Pons, midbrain till this point. This is the cerebellum. So let's focus on our task here. This is the pineal gland as shown here. Just below the pineal gland, these are a pair of superior colliculi and these are inferior colliculi. Then I'm not going into the detail of the other structures of the brainstem. The trochlear nerve that is going on. If you're interested, we have a lecture uploaded on the YouTube regarding the gross and cross-sectional structure of the brainstem. Above, the third ventricle, it's not opening, it's cut open and shown to you here. On each side of the third ventricle, the posterior end of thalamus is shown. On inferior aspect of thalamus, these medial and lateral geniculate bodies are shown. Medial and lateral geniculate bodies are shown. So all of these structures, these are pineal gland, superior colliculi, inferior colliculi. This is third ventricle, thalamus, posterior end. We will see that is a pulvinar nucleus, lateral and medial geniculate bodies. So these are the sections that we can see from the back. If we shift our view to a little posterolateral aspect, we will have somewhat of a similar picture. But one thing that I would like to bring focus on is this structure. This is the superior colliculus, this is the lateral geniculate body. I want to put focus a little on the connection between the two. So superior colliculus is connected to lateral geniculate body through this bridge of tissue that is called superior brachium. Similarly, you will see inferior colliculus connected to the medial geniculate body through inferior brachium. So these are the structures that I wanted to highlight. Okay. Other things more or less are the same. The two colliculi you have already seen. This is the pineal gland, that is the posterior end of the thalamus, and all of this is thalamus. We will see further as we go on. If you move your field of view or point of view, from the inferior aspect, from forward to backwards, you will be able to see optic nerve, chiasm, pituitary, tuber cinerarium if it is not covered by pituitary, mammillary bodies, and these structures. Let us see. So this is the inferior aspect. This picture has been cut from somewhere here, and you can see this midbrain with its aqueduct, red nucleus, substantia nigra. From front to back, let us follow optic nerve. This is the optic nerve. Here it is cut. Next, from the optic nerve, next comes optic chiasm. This midline crossing fibers, this is the optic chiasm shown right here. Next one, this one is the pituitary gland. You are looking from here, so this is shown. So behind it, these structures are not visible, hidden by it. Then these two mammillary bodies, as seen right here, and behind it, this structure. This is this area. If you go through our lecture of brainstem, this is called peduncles of brainstem of midbrain. So this area is interpeduncular fossa, and this perforated tissue between them, this is called posterior perforated substance, as these are the anterior perforated substance. Let us zoom in. So there is optic nerve, chiasm, hypophysis or pituitary, tuber cinerarium somewhat visible here, mammillary bodies, midbrain interpeduncular region, and through it posterior perforated substance. So these are all the structures of diencephalon, as can be seen externally. If you are dealing with some model or a tissue and even in surgery, you will see these structures. Now let us talk about the sections that you will see in cross sections, in sagittal, horizontal, and coronal, and these are the views that you are going to see in radiology, the MRIs and CT scans. So let us first start with sagittal section. For making sagittal section, you will pass a plane between the two thalami from the midline, anteroposteriorly running, and it will split your whole brain into two halves, right and left half. So this is whole of the cranial cavity split into two parts. We have cut and removed the left half. This is a picture from Netter's atlas, and we are looking at the right sided hemisphere from the left aspect. So let us focus on our area of interest here. Let us discuss on the larger model rather. So this whole big area, this ball like area, this is the thalamus. You are viewing from here and you just saw thalamus. Between two thalami, they are interconnected with one another, bridging the third ventricle. So this is called interthalamic adhesion, the bridge that is shown right here. Behind the thalamus, there is pineal gland. You will see it right here. Pineal gland is connected to the thalamus through its stalk. Here the stalk is shown, and you will see the stalk. Here is the gland, and this is the stalk that you will see. Rather, here is the gland, and this is the stalk that you see. And within the stalk, you will see two elevations, this one and this one. This above, this dilated area, it is the habenular commissure that you see the midline crossing fibers. As we discussed earlier, anterior and inferior to the thalamus is hypothalamus. So this is a line that is demarcating the division between the thalamus and hypothalamus, also known as hypothalamic sulcus. Above it is thalamus and below it is hypothalamus. So this all area Anterior to it, all this area, this is hypothalamus. Up till now we have done thalamus, interthalamic adhesion, hypothalamic sulcus, hypothalamus, pineal gland, stalk, habenular commissure, posterior commissure. Let's add more structures to it. The red thing that you can see right here, this is the choroid plexus of the third ventricle. This is the part where CSF is generated and entered into the third ventricle. Above it, this structure all the way going, it's going by the way till here. This is the one shown here. This is called fornix. This is called fornix. We will see fornix in detail in the subsequent lectures. I will go in the anatomy, discuss it with Diencephalon, then we will see it in the limbic system also. So here is the body of the fornix. Here is the columns of the fornix. Behind the thalamus there are crus of the fornix, but that's not our discussion right now. So that's the fornix right here. This line, if you are able to appreciate it, these structures that are going right here, these are called stria terminalis. And then these are the hair structures. This is anterior commissure. This is optic chiasm. Between them, this is lamina terminalis. Below, this is pituitary. This is stalk of the pituitary, also known as infundibulum, and this is the raised area on the undersurface. This raised surface is called tuber cinereum. And here you are able to see these are mammillary bodies. And then behind you will start the brainstem, midbrain, pons, medulla oblongata. These structures demarcate the boundary of diencephalon. In front of it, telencephalon starts. Above it, telencephalon starts. But just for the reference, I will let you know this is septum pellucidum, and this whole area, this structure, this is part of telencephalon midline crossing fiber. These are called corpus callosum. So these are the structures that are visible from the mid-sagittal section. Let me quickly go through them again. The thalamus, interthalamic adhesion, below there is hypothalamic sulcus, stria terminalis, choroid plexus, fornix, body, pineal gland, habenular commissure, posterior commissure, hypothalamus, anterior commissure, lamina terminalis, optic chiasm, pituitary gland, pituitary stalk, infundibulum, pituitary gland, hypophysis. This is tuber cinereum, mammillary bodies, and then there is anterior perforated substance, midbrain, pons, and medulla oblongata. Behind there is cerebellum and fourth ventricle. These are the colliculi. So these are the structures that you can see on the mid-sagittal aspect. Moving on, let's see the horizontal section. How will it show? Horizontal section, this is again a picture from Netter's Atlas. If you cut a horizontal section at the level of foramen Monro, you will see in the midline there is a cavity. This cavity is the third ventricle. You will see this cavity right here. Behind is the pineal gland. You will see pineal gland right here. This is the pineal gland. Just anterior to the pineal gland on either side of the cavity, this is thalamus. And here you will see thalamus right here. So this is thalamus. This is thalamus. Anterior to the thalamus, there is opening to the lateral ventricle, that is foramen of Monro. So here you will see foramen of Monro. Here is the foramen of Monro anterior to the third ventricle, anterior to the thalamus, and it is connecting to the lateral ventricle. So this is the anterior horn of the lateral ventricle. Anterior to the foramen Monro is fornix. Behind there was thalamus, anteriorly there was fornix. So it is visible here. Behind there is thalamus, anteriorly there is fornix. Between fornix and corpus callosum there is septum pellucidum. Here, this part of septum pellucidum of corpus callosum is shown right here. This is part of the fornix that is shown right here, and between them there is septum pellucidum that is shown right here. On either side there is caudate nucleus. I'm not going into the detail of the caudate nucleus. We will see it has a very peculiar structure like a mouse. It starts in front of the thalamus and goes up and back and behind and below the thalamus. In almost 3/4 of a circle it covers it. But let us leave it like this. If you are more interested in this, see the internal structure of Diencephalon lecture that where I have discussed this in more detail. On either side, this white area, this structure, this is the internal capsule. This area, this boomerang like or this bend V shape like structure, this is the internal capsule. And on the lateral side of internal capsule there is a lens like nucleus, again that is beyond the scope of this lecture, that is the lentiform nucleus. Then there are structures beyond that I'm not going to discuss right now. So regarding thalamus, which structures did we do? The third ventricle, thalamus on either side, pineal gland on the back. Behind pineal gland there will be corpus callosum, that is, you can see it right here, that is corpus callosum. And then there is anterior to the thalamus there is foramen of Monro, anterior to the thalamus foramen of Monro, and anterior to the foramen of Monro fornix, anterior to the foramen of Monro fornix. Then on foramen of Monro, that fornix and corpus callosum, between them there is septum pellucidum that is seen here. On either side there is lateral ventricle, anterior horn, there is caudate nucleus, this is internal capsule, and that is lentiform nucleus. So that's about it. Now move on to the next, that is the coronal section, that is the coronal or frontal section. That is the section, if you see it, it is a little behind the, there can be many coronal sections. This particular one is a little behind the anterior end of the thalamus, that is the foramen of Monro. Here you can see on either side there is thalamus. So this is thalamus, like this area is thalamus. On between them there is third ventricle, between them there is third ventricle. On the upper end there will be for tilia choroida and choroid plexus and the fornix. Above it you will see choroid plexus and fornix. Above that corpus callosum with septum pellucidum intervening. Above that septum pellucidum with corpus callosum here. On below the thalamus, this area, this is the hypothalamus. Below it there will be mammillary bodies right here, and on either side, as we saw here, on either side there was internal capsule that you will see right here, and this structure that is again the caudate nucleus. As I talked about, caudate nucleus somewhere start right here and goes up and like this, it goes like this. So in this picture you saw caudate nucleus here and here, as you saw it here and here, and now in the next picture we are seeing caudate nucleus right here. So yes, so Here you are seeing the caudate nucleus. On the top of the thalamus, there is the lateral ventricles, the body of the lateral ventricles. We will go into the further details of the structure that are present here in the lecture of the ventricles that I welcome you to watch. And these are the body of the ventricles. This is the choroid plexus of the lateral ventricles, thalamostriate veins and stria, medullaris thalami are present there, and so on. The other structures that are present there too. Okay, so this is the sections. These are the different sections and pictures of the diencephalon. I would suggest you here to pause the video right here and quickly go through these sections. If you are confident about these pictures, the rest of the lecture will be very easy for you because we will be extrapolating the information found on these images to define the boundaries of the different structures, the diencephalon itself, thalamus, hypothalamus, and the other structures. So, inferior surface. Inferior surface, it is made up of from front to back, the diencephalon, optic tract, chiasm, optic nerve, chiasm, tract, pituitary gland, hypophysis, infundibulum, tuber cinereum, mammillary bodies. So these are the structures that are seen here. Technically speaking, anterior pituitary, it's not a part of diencephalon because it was developed from Reti's pouch. Posterior pituitary is a part of diencephalon because it is a downward extension to it. That's again a different discussion regarding embryology. These structures are visible. Lateral surface, as we saw here, the lateral surface is made up of internal capsule. The lateral surface or lateral wall or lateral bounds are by internal capsule. Beyond it, it's a part of telencephalon. To be more specific, lentiform nucleus. This caudate nucleus, this lentiform nucleus, these are part of telencephalon. Superior surface, we saw right here. Just from here to here, just see the structure which are present. There is teleochorida of the third ventricle, there is fornix, thalamostriate vessels, body of the lateral ventricle, choroid plexus of the ventricle, and then there is this is thalamostriate vein, this is great cerebral vein, internal cerebral veins, and this is caudate nucleus. So these are all the structures present here. This is a particular image that is taken from the top after removing the corpus callosum and different structures. So these are the thalami. These structures are the thalami, and on the top of that there is stria terminalis that we saw somewhere right here. We will see it somewhere right here, and on the medial aspect you will see this fornix, as you can see it here, and you will see it here, and choroid plexus will be beneath it. So there will be fornix, there will be roof of the third ventricle itself, and you will see two words continuously together, teleochorida and choroid plexus. The extension of the pia mater that is very highly vascularized, that is covering it, that is inside it, the ventricle, that is called teleochorida, and it is covered by a layer of epithelium like structure that is ependyma. So this whole together that is called choroid plexus. This is a picture from later, and with the light green, light red color that they have made teleochorida, and with solid red color they have made ependyma, and together the structure is called choroid plexus. This is true for both choroid plexus of the third ventricle and choroid plexus of the lateral ventricle. Medial surface, we have already done that. All the structures that were present, lateral wall of third ventricle basically, or medial wall of this contains thalamus, interthalamic adhesion, stria terminalis, choroid plexus, fornix. Fornix will be superiorly, there will be hypothalamic sulcus, hypothalamus, and all these structures. This is stria medullaris thalami, sorry. Extent of diencephalon anteriorly, foramen, interventricular foramen of Monro. So this is roughly the line that makes the diencephalon. So there is interventricular foramen. Here is the fornix. Here is the anterior commissure. Here is the lamina terminalis. So, and optic chiasm will be at the boundary of the two. So these are the structures that are present on the anterior bound of diencephalon. Posteriorly, majorly this is decided by the opening of the aqueduct of Sylvius. Then behind you can say that two commissures, posterior and habenular, and optic, this pineal stalk and pineal gland. So these are the structures that are making the posterior end. And talking about in terms of CSF flow, anterior end will be made by interventricular foramen of Monro and posteriorly by aqueduct of Sylvius. We can see the boundaries of the thalamus. The thalamus, these are the same pictures. Let's go through them one by one. The anterior end of the thalamus, it's bounded by this fornix, and between anterior end and the fornix there is foramen of Monro, and this is the narrow anterior end. Posterior end is somewhere here, not very clear in this picture, but very clear in this picture. This overhanging portion, this is called pulvinar. We will see it's in the lecture of the thalamus, and below it there is a geniculate body, the lateral geniculate body and the medial geniculate body that are present here. Next, our superior surface, the thalamus itself, from here to here. So there will be the same structure that we discussed. On the medial aspect there will be tilia choroida of the third ventricle and fornix. On the lateral aspect there will be fourth ventricle, lateral ventricle floor with its ependyma and choroid plexus and the neighboring structures that will contain cerebral vein and stria terminalis and thalamostriate veins. Inferior surface, here the inferior surface anteriorly through hypothalamic sulcus there was hypothalamus, anteriorly there was hypothalamus, posteriorly it is majorly related to the tegmentum of midbrain. So here in this picture that is taken somewhere here, this is the hypothalamus that you can see just beneath thalamus. Medial surface, again the same structures. This is the stria medullaris thalami, thalamic adhesion and all that structures. Lateral surface, lateral wall of the thalamus, lateral relation of the thalamus is with the internal capsule that are present on either side. You can see in the coronal section and the horizontal sections. Subthalamus, here I am just discussing the location of the subthalamus. It is present beneath the thalamus but above the tegmentum of midbrain. In other words, it is related infralateral to the thalamus. Functionally, it is related to the basal ganglia and its relation links to movement disorders. We will discuss that in the basal ganglia lectures. And that's it. That's what I wanted to discuss in this part of my lecture. Epithalamus, as we already discussed, it consists of pineal gland, habenular nuclei, habenular commissure, and pineal gland majorly. You can see this in this picture. This is a picture from Natus. This is the pineal gland. Here in the posteromedial aspect of thalamus, these are the habenular nuclei. Mostly you will see habenular trigone labeled, and there will be habenular commissure in front of it somewhere here. This is the third ventricle, that is the internal cerebral vein, thalamus, choroid plexus of lateral ventricle, and thalamostriate vein and caudate nucleus. Let's not get carried away. Coming back to our own topic, this pineal gland, habenular nuclei or habenular trigone area. Here is the commissure. So what is the function of these nuclei? These nuclei are present posteromedial to the thalamus. They get their afferents, they get their inputs from amygdaloid nucleus, part of a limbic system, and the striamedullaris thalami, the fibers on the medial aspect of thalamus that we saw in the sagittal sections, they are carrying the fibers from the medullary nucleus all the way till the habenular nuclei. And hippocampal formation via fornix, this is again not discussed in this lecture, but fornix you have seen. The fornix, through fornix, the signals come to the habenular commissure, and its efferents goes in a variety of different structures. These are interpeduncular nuclei, tectum of midbrain, thalamus, reticular formation, and it is the area where a lot of integration of signals, especially olfactory, visceral, and somatic, often that occurs here. Pineal gland or pineal body that is present on the posterior aspect of the diencephalon connected through the stalk. It is overhanging the midbrain, overhanging the posterior aspect of midbrain. You will see it lying between the two superior colliculi. This particular structure is hanging with the pineal stalk, and this stalk it's hollow from inside. So this is the pineal recess of the third ventricle. We will discuss the recesses in the ventricle lectures. And this is pineal recess. Above it there is habenular commissure. Below it there is posterior commissure. This pineal gland itself, it's partially divided into different lobules. It has multiple types of cells. The most important ones are pinealocytes and glial cells. The functional cells are pinealocytes, and this area has a very interesting histology of having concretions called brain sand, and that is visible in radiology also. That is helpful landmark for figuring out the midline of the brain. These structures, they influence a variety of organs including pituitary gland, pancreas, parathyroid, adrenal, gonads, and by influencing these structures, and they maintain the circadian rhythm. And it is itself, pineal gland itself is influenced by light, and it is active during dark hours when you are sleeping, especially the signals from retina mm, goes to optic nerve chiasm, and from that point some of them leave this visual optic pathway and go to the hypothalamic nucleus, that is suprachiasmatic nucleus. And from there is a tegmentum of the midbrain, the pineal gland, and the pineal gland itself releases melatonin. It is released into the CSF in the third ventricle and in the blood, and its levels raise during the night, and it influences all of these structures as we mentioned. And that's why the sugar level fluctuates, the gonadal hormone levels fluctuates, the steroid hormone levels fluctuates in a systematic manner during day and night cycle. So that is pineal gland. Hypothalamus. Hypothalamus, just talking about the boundaries here, we will discuss its functions. Anteriorly, this is the boundary of the hypothalamus from optic chiasm to the anterior commissure with lamina terminalis intervening, and below it is below the hypothalamic sulcus, and it is very closely placed to the limbic system that is on the surrounding it, and superiorly it is related to the thalamus and hypothalamus, hypophysis, pituitary, and all the ascending tracts are very in approach to it. So it is in a very center of the structures. It is a very important organ, regardless of its very miniature size. It is so important, obligated to life. We will discuss it in the lecture of hypothalamus. Here, yes, one thing that you can discuss is the relations. The relations that anteriorly you will see the boundaries of the lamina terminalis, anterior commissure, and optic chiasm, and some part of hypothalamus. Functionally, it's anterior to the lamina terminalis called preoptic area. Caudally, here you will see the tegmentum of midbrain. Superiorly, you will see thalamus. Infrolaterally, you will see subthalamic nuclei, and inferior surface from front to back optic chiasm, tuber cinereum, infundibulum, and pituitary, and mammillary bodies behind. Optic chiasm, tuber cinereum, stalk, and pituitary, and mammillary bodies. So these are the structures that you can see right here, especially superiorly thalamus. It's very visible here. and the other structures are mostly the same. The anterior, the inferior, the superior hypothalamic sulcus is the superior boundary. Optic chiasm, you have discussed this in detail in the visual pathway lecture, and that is the junction of the anterior wall and roof, and its relation to the superior aspect will be attached to the lamina terminalis. Inferiorly, it will be related to the pituitary hypophysis. Anterolaterally, so anterolaterally it is related to the optic nerve. Posterolaterally, it will be related to the optic tracts. This relation of the pituitary to the optic chiasm is very important because any pathology that increases the size of the pituitary, most cases that includes a tumor, and that leads to the compression of the optic chiasm and related visual defects. And here there is an optic recess of the third ventricle on the top of it. Tuber cinereum is this portion, the raised portion of the inferior surface of the diencephalon. Somewhere here, this area from where the infundibulum raises. So this is tuber cinereum. Infundibulum itself is the stalk. It is hollow, and due to its hollow nature, the CSF from the third ventricle continues into it. That is called the infundibular recess, and it continues downward to make the posterior pituitary gland. Just remember, the anterior pituitary is different embryologically from different origin. The mammillary bodies shown here and here are the structures that are posterior to the tuber cinereum. It has central core of gray matter with surrounding white matter, and it is somewhat related to the limbic system, and it has different functions. You will see it in coronal section 2. Posteriorly, it is related to the posterior perforated substance. Third ventricle. The third ventricle anteriorly it is connected to the lateral ventricle through foramen of Monro. Posteriorly, it is connected to the fourth ventricle to the aqueduct of Sylvius. Its walls you discussing it in detail in the lecture on the ventricles, but anteriorly it is the same line. Anterior commissure lamina terminalis optic chiasm and anterior columns of fornix 2. Posteriorly, you will start from here to here. Pineal gland, habenular commissure, pineal stalk, pineal gland, posterior commissure, and then there will be midbrain will start. The lateral ventricle, and that is the opening of the cerebral aqueduct. The lateral aspect you will see better here. On the lateral aspect, superiorly there is hypothalamus, inferiorly there is thalamus, inferiorly there is hypothalamus, between them hypothalamic sulcus, and here these are stria medullaris thalami. So these structures, stria medullaris thalami, are also visible. Superior aspect, this one, you will see tilia choroida of the third ventricle of tilia choroida plus ependymal choroid plexus shown here and here. Above it there is fornix. Still above it there will be third corpus callosum, that is more in direct connection on the posterior aspect. Inferiorly, these are again the same structures that are forming the inferior wall of the diencephalon, that are forming the inferior wall of the hypothalamus, and all these structures. Thank you so much. I hope so lecture was helpful for you. If you have any questions, suggestions and feedback, please mention in the comment below. I will be very happy to answer these. Till the next lecture. Allah Hafiz.